It often happens quietly and unexpectedly. A man reaches orgasm, the sensation feels familiar, the muscles contract, the moment passes, and then he notices something strange. There is little semen, or sometimes none at all, no pain, no blood, no obvious problem, just absence. For many men over 60, this moment triggers silent worry. Some think it means weakness. Some fear permanent damage. Others wonder if something inside has stopped working. What makes this confusing is that nobody talks about it openly, and internet advice swings between panic and misinformation. Medically speaking, this experience is far more common in older men than most realize, and in many cases it is not dangerous, but it is always meaningful. The body is giving information, and understanding that message matters. As men age, the sexual response changes in ways that are subtle but real. Orgasm and ejaculation, although they occur together in younger men, are actually two different physiological processes. Orgasm is controlled largely by the brain and nervous system, while ejaculation depends on coordinated function of the prostate, seminal vesicles, vas deferens, bladder neck, pelvic nerves, and smooth muscles. After 60, any part of this system can change. When a man experiences orgasm without semen release, doctors call this condition anejaculation, or, in some cases, retrograde ejaculation, depending on where the semen goes. This distinction is important because the cause determines whether the situation is harmless, medication-related, nerve-related, or a sign of an underlying condition. One of the most common reasons older men experience little or no semen during ejaculation is age-related reduction in semen volume. Research published in urology and andrology journals shows that semen volume naturally declines with age due to reduced activity of the seminal vesicles and prostate gland. Testosterone levels fall gradually, and these glands depend on testosterone for optimal secretion. By the 60s and 70s, it is normal for semen volume to be significantly lower than in earlier decades. In these cases, ejaculation still occurs, but the visible output is reduced. This is not harmful, does not weaken the body, and does not mean sexual function is lost. It simply reflects aging glandular activity. However, when semen seems to disappear entirely, the most common medical explanation in seniors is retrograde ejaculation. In this condition, semen does not exit through the penis, but instead flows backward into the bladder. This happens when the muscle at the bladder neck does not close properly during ejaculation. In younger men, this muscle contracts tightly, directing semen outward. In older men, especially those with diabetes, nerve damage, prostate surgery, or certain medications, this muscle may weaken. The sensation of orgasm remains normal, but ejaculation appears dry. Later, semen leaves the body harmlessly during urination, usually unnoticed. Medications are one of the leading contributors to this issue after 60. Drugs used to treat enlarged prostate, high blood pressure, and depression, such as alpha blockers and certain antidepressants, can relax the bladder neck muscle. Clinical studies have repeatedly shown that men taking these medications frequently report reduced or absent semen during ejaculation. Importantly, this is a functional side effect, not sexual failure. The nerves and pleasure pathways still work, but the direction of semen flow changes. Many men panic unnecessarily because no one explained this possibility when the medication was prescribed. Another major cause is nerve-related changes, especially in men with long-standing diabetes. Diabetes damages small nerves over time, including the autonomic nerves responsible for ejaculation. Medical literature documents that diabetic autonomic neuropathy can interfere with the emission phase of ejaculation, leading to weak, delayed, or absent semen release. This does not happen suddenly. It develops gradually. Men may first notice reduced force, then reduced volume, and eventually dry orgasm. In such cases, the issue reflects nerve signaling, not loss of masculinity or desire. Prostate-related changes also play a significant role. The prostate contributes fluid to semen and helps propel it outward. With age, the prostate often enlarges or undergoes treatment. Men who have had prostate surgery, radiation, or long-term prostate inflammation may experience changes in ejaculatory volume. After certain prostate procedures, dry ejaculation is expected and permanent. This does not affect lifespan or general health, but it does change sexual mechanics. Many men are not adequately counseled about this beforehand, leading to confusion later. Hormonal factors matter as well. Testosterone decline affects libido more than ejaculation, but very low testosterone can reduce glandular secretions. Studies in endocrinology show that men with significantly low testosterone often report weaker orgasms and reduced semen volume. However, testosterone alone rarely causes complete absence of semen. It usually acts in combination with nerve or prostate changes. Psychological stress should not be overlooked. Anxiety, fear, and hyperfocus on performance can disrupt the ejaculatory reflex, especially in older men whose nervous systems are more sensitive. The more a man worries about whether semen will appear, the more likely the reflex is interrupted. This does not mean the problem is in the head, in a dismissive sense. It means the brain plays a powerful role in sexual coordination, especially with age. One fear many men have is whether dry ejaculation is dangerous. Medically, it is not dangerous by itself. The body is not harmed by reabsorbing semen or redirecting it to the bladder. It does not cause weakness, memory loss, bone loss, or reduced lifespan. These are myths. However, the underlying cause may need attention, especially if the change is sudden, accompanied by pain, blood, urinary symptoms, or erectile changes. In those cases, medical evaluation is important. Fertility concerns are usually not relevant for men over 60, but it is worth noting that dry ejaculation can affect fertility because semen does not exit the body. For seniors, the more relevant concern is comfort, confidence, and understanding what is happening. Sexual health after 60 is about quality, not reproduction. Another common misunderstanding is the belief that semen retention increases strength or vitality. Scientific research does not support this idea. While excessive fatigue can occur if sexual activity exceeds recovery capacity, the absence of semen itself does not preserve energy. Energy levels depend far more on sleep, nutrition, hormones, cardiovascular health, and mental well-being. In clinical practice, many older men feel relieved once they understand that dry ejaculation is often a mechanical or medication-related change rather than a sign of decline. When men stop fearing the experience, satisfaction often improves. Sexual pleasure does not disappear just because semen volume changes. The brain's perception of pleasure, intimacy, and connection remains intact. So, what should a man do if he experiences ejaculation without semen? First, observe patterns. Is it consistent or occasional? Did it start after a new medication or surgery? Are there urinary symptoms like burning, difficulty urinating, or cloudy urine? These details help doctors identify the cause. Second, understand that this condition is common after 60 and usually manageable. In some cases, adjusting medication timing or type can help. In others, Reassurance is the best treatment. Most importantly, men should understand that aging changes sexual expression, not sexual worth. The body adapts. Pleasure adapts. The healthiest men after 60 are not those chasing youth, but those who understand their body's new rhythm and work with it, not against it. In summary, if you ejaculate and no semen comes out, it does not automatically mean something is wrong. It may reflect natural aging, medication effects, nerve changes, or prostate mechanics. It is rarely dangerous, often explainable, and frequently manageable. Knowledge replaces fear, and when fear leaves, sexual health often becomes more relaxed, confident, and satisfying, even with age.